Hello everyone, and welcome to today's presentation. I'm Dr. Niyaz Ahmed, and I'm glad you could join us. Today we'll be discussing a very important topic. What is the best treatment for fungal infection? We'll explore the different options available, how to identify the right treatment, and some tips for effective skin care. I'm here to share useful insights that can help you better understand and manage fungal infections. Let's get started. Let's take a closer look at how fungal problems happen. Fungal infections are actually quite common, especially on the skin, hair, and nails. They occur when fungi, which are tiny organisms like dermatophytes, candida, or malassezia, start to overgrow either on or inside the body. Now, what causes these fungi to overgrow? One major factor is moisture and sweat. Fungi love warm, damp places like the armpits, groin, feet, or under the breasts. If these areas stay moist, it creates the perfect environment for fungi to thrive. Poor hygiene also plays a role. Wearing unwashed clothes or tight clothing can trap moisture and promote fungal growth. Additionally, a weakened immune system, whether from conditions like diabetes, HIV, or even prolonged steroid use, can make it easier for fungi to take hold and cause infections. Antibiotic use is another factor. When we take antibiotics, they kill off healthy bacteria that normally keep fungi in check, especially candida. Without those good bacteria, fungi can overgrow more easily. Close contact with others can also spread fungi. Sharing towels, clothes, or coming into contact with infected people or pets increases the risk. Lastly, the environment matters. Hot, humid climates provide an ideal setting for fungi to flourish. So overall, a combination of environmental, personal hygiene, immune health, and contact factors all contribute to how fungal problems develop. Recognizing these causes helps us better understand how to prevent and manage these infections effectively. Let's take a closer look at some common types of fungal infections you might encounter. First up is tinea, also known as ringworm. You'll notice it presents as circular, red patches that are often itchy, and it can appear on various parts of the skin. Despite the name, it's not a worm at all. It's caused by a fungus. Next is athlete's foot, or tinea pedis. This typically affects the spaces between your toes, causing scaling and intense itching. It's especially common among athletes, hence the name. Proper hygiene and keeping your feet dry can really help prevent it. Then we have jock itch, or tinea cruris. This one shows up as a rash in the groin area, often making the skin red and irritated. It's quite common in warm, moist environments, so wearing breathable clothing can make a difference. Moving on to nail fungus, or onychomycosis. This affects the nails, making them thick, discolored, and sometimes brittle. It can be quite stubborn, so early treatment is key to prevent it from worsening. Finally, there are yeast infections caused by candida. These can affect skin folds, like underneath the breasts or armpits, as well as the mouth, what we call thrush, or even the genitals. They often cause redness, irritation, and discomfort. Understanding these types helps us recognize the signs early and take appropriate action, which is essential in managing fungal infections effectively and reducing their spread. Let's take a closer look at some common symptoms that can help us identify fungal infections. First, you might notice an itching or burning sensation on the affected area, which can be quite uncomfortable. Next, the skin may appear red, scaly, or even cracked, indicating irritation and inflammation. If the infection is in the mouth or vaginal area, you might see white patches. These are typical signs of oral or vaginal candida. In cases involving nails, discoloration or thickening can occur, often causing discomfort or cosmetic concerns. Additionally, a spreading rash with a clear edge is another key symptom. It shows how the infection can expand if not treated promptly. Recognizing these signs early is essential for effective management and helps connect to the overall theme of understanding and addressing fungal infections. Now, let's talk about treatment options. The approach to treatment really depends on the type and severity of the condition. For some cases, a less aggressive approach might be enough, while others may require more intensive interventions. It's important to tailor the treatment plan to each individual, considering how serious the situation is. This way, we can ensure the most effective care. Remember, understanding the specific characteristics of the condition helps us choose the best course of action and ultimately leads to better outcomes. Let's talk about treatment options for mild fungal infections. When the infection is not severe, topical antifungals are often the first choice. These are applied directly to the affected area and include creams, gels, powders, and sprays, making it easy to find a form that works best for you. Some common examples are clotrimazole, terbinafine, ketoconazole, and miconazole. These medications typically need to be used for about 2 to 4 weeks, although sometimes longer treatment may be necessary depending on the severity and response. The key here is consistency and patience to ensure the infection clears completely. Using topical antifungals effectively is an important step in managing mild infections and preventing them from worsening or spreading. Now, let's talk about some treatment options for more severe or resistant fungal infections, especially when topical treatments aren't enough. One of the main approaches is using oral antifungals. These are typically prescribed when the infection is more advanced, resistant to other treatments, or if it's affecting the nails. Some common oral antifungal medications include itraconazole, fluconazole, and terbinafine tablets. Each of these has a specific way of working and different considerations, so your healthcare provider will choose the best one for your specific situation. It's important to note that the duration of treatment can vary quite a bit, from a few weeks to several months, depending on the site of the infection and how well you're responding to the medication. For example, nail infections usually require longer treatment courses. Overall, these oral options are a key part of managing more stubborn fungal infections, and working closely with your healthcare provider helps ensure the best outcome. Now, let's talk about some supportive care measures that can really help manage this condition. First, it's important to keep the affected area dry and clean. This helps prevent the fungus from thriving. Next, make sure to change your clothes frequently, especially undergarments and socks, because moisture and sweat can make things worse. It's also a good idea to avoid sharing personal items like towels or clothing to prevent spreading the infection. Lastly, using antifungal powders in sweaty areas can help keep your skin dry and reduce the risk of irritation. These simple steps are key parts of supportive care and can make a big difference in your recovery process. Now, let's talk about treatment options for recurrent cases. First, it's important to check for any underlying conditions like diabetes or weak immunity. These factors can influence how well the treatment works and may need to be addressed alongside the primary therapy. Next, keep in mind that long-term maintenance treatment might be necessary to prevent future recurrences. This isn't always a quick fix. Sometimes, a sustained approach is key to managing the condition effectively. Overall, understanding and addressing these underlying factors, along with consistent maintenance, can make a significant difference in patient outcomes. Let's talk about some key prevention tips to keep fungal infections at bay. First, it's important to bathe daily and dry your body thoroughly afterward. Moisture can promote fungal growth, so keeping your skin dry is essential. Next, wear cotton, loose-fitting clothes whenever possible. This helps your skin breathe and reduces the chance of sweating and trapping moisture. It's also crucial to avoid excessive use of steroids on your skin, as they can actually make fungal problems worse. If you're diabetic, controlling your blood sugar levels is vital because high sugar levels create an ideal environment for fungi to thrive. Lastly, keep your nails trimmed and clean. Fungal infections can sometimes start under the nails, so good nail hygiene can prevent that from happening. All these steps are simple but effective ways to help prevent fungal infections and support overall skin health. Welcome to our skincare clinic. I'm Dr. Niyaz Ahmed, and I'm here to help you achieve the best skin health possible. If you have any questions or want to learn more about our treatments, please feel free to contact us at 9,303,214,285. We're dedicated to providing personalized care to meet your unique skin needs. Remember, healthy skin is a reflection of overall wellness, and we're here to support you on that journey. Thank you for your attention, and we look forward to assisting you soon. Thank you all for your time and attention today. I truly appreciate your interest and engagement. If you have any questions or want to discuss anything further, please don't hesitate to reach out. You can contact me via mobile at 9,303,214,285 or visit my website at drniyazahmed.com for more information. Also, feel free to email me at ma9,700,072@gmail.com. Once again, thank you so much for being part of this presentation. I look forward to connecting with you all soon.